Hi, Ira Wahrman Acupuncturist here. I'm going to share with you a little bit on the different treatments that we use in the office to treat various conditions. Chinese medicine overview. So what it is and what it's not. Chinese medicine is the oldest form of primary care medicine in the world. Primary care meaning this is for, in history, this was used for someone that had stab wounds, to a cold, to a broken bone, to infectious disease, to malaria, whatever it may be, whatever we go to the doctor for now, Chinese medicine was the primary care treatment for all those illnesses for thousands of years in China. It's a medical system that was used as primary care for over 2,000 years in East Asian countries. So again, it was a primary care system. It's no longer used as primary care, but it was a primary healthcare system used in East Asian countries such as Korea, Japan, Vietnam, China, and among others in Southeast Asia. It's also a medical system which has multiple modalities. Acupuncture is only one of them. So when going for treatment, there are multiple treatment methods within Chinese medicine, acupuncture being only one of them. There's Moxibustion, massage therapy, which is a type of Toina, which is a type of bodywork, reflexology, internal herbal medicine, external herbal medicine, lifestyle and dietary counseling, cupping, Gua Sha, Qigong. There's lots of different modalities. Acupuncture is only one of them. They all have their strengths, and they all have some weaknesses. Chinese medicine is a medical system that not only alleviates symptoms, but also helps to alleviate the cause of symptoms. So we're not just treating your eczema or your stuffy nose or your back pain or your irregular menstrual period. We're looking at what's causing these particular symptoms. Is your sleep disturbed? Is your digestion disturbed? Are you eating certain foods that are going to trigger your symptoms when we work to find out what those foods are? Are you getting enough rest? Are you overworked? Are you underrested? All these things we look at the whole body. It's a holistic form of medicine. So again, if you come in for a skin condition, your skin is part of your body. The skin isn't separate from every other part of your body. So if you come in with eczema and you have a lot of itching and you have a lot of rashes, we're going to look at your stool. Are you having regular bowel movements? Are you sleeping through the night? How's your anxiety level? For ladies, how is your menstrual cycle? Any body pain? Any history of trauma? Head to toe, we're looking at all your symptoms to treat the main complaint, which in this case we're talking about would be a skin condition. And then we're looking at all the underlying things that are contributing to that skin condition. And we will address all through treatment. Chinese medicine is a technical and scholarly medical system that has predictable results. So there's a lot of techniques that we employ in treating various conditions. There's a long historical record, a lot of classical texts, classical and modern texts. The writings within Chinese medicine can fill up, a large public library in your town. It's very vast, and all of the treatments, acupuncture, massage, herbal medicine, all these things have been used to treat billions of patients for thousands of years. So there's a lot of literature. There's been a lot of trial and error. There's been scholarly work. There's folk medicine. So a lot of this stuff is figured out in a way to make it the most efficacious, but also to make it the most tolerable to the body with the least amount of side effects. So what is it not? Chinese medicine is not a spa treatment. So you can go to a spa and get a massage or a foot massage. It's not necessarily going to be a medical treatment. So acupuncture, Chinese herbs, While relaxing, our main goal is to help you to overcome whatever particular health concern you are coming for. A side effect of that may be more relaxation, but our main goal is to help you reach your health goals and to help you overcome whatever health condition you're dealing with. Acupuncture in Chinese medicine is not new age or magical. It's all there's a specific theory that we're employing. Everything is thought out. Everything is very methodical in how it's being employed. Again, it's not new age medicine. Chinese medicine has been around for thousands of years and treating billions of patients in multiple countries. Again, it's not only acupuncture. A lot of patients come for treatment expecting only to get acupuncture, or they heard about acupuncture, but there are a lot of other modalities that are employed in the treatment of various conditions. It's not a medical system based on belief. So some people think, oh, if I don't believe in acupuncture, it doesn't work. That's not necessarily the case. Whether you believe it in or not, when needle is put in, when you ingest an herb, when Moxibustion is done, when cupping is done, there's certain things happening in your body that will happen. It's a physiological changes. So it doesn't matter if you believe it or not. It is an effective system of medicine. It's not a religion. Some patients are a little bit concerned that if this will conflict with their religion. I don't think it will. It's not from throughout Chinese history. Chinese medicine was not necessarily attached to any particular religion. There are some religions that used it, but it wasn't necessarily formed as a religious practice. So it has nothing to do with religion. And it's not a guessing game. Every step of the way, there's a clear plan. The methods that will be employed during your treatment are treatments and methods that I have used effectively to treat various patients, and physicians throughout centuries have used effectively. So everything that's done is a rhyme, is a reason, and there's little guesswork in Chinese medicine. So again, the modalities within Chinese medicine is not just acupuncture. We have acupuncture, Moxibustion, Tui Na, and reflexology, which are both types of Chinese medicine bodywork, cupping, Gua Sha, internal herbal medicine, external herbal medicine, Qigong, lifestyle, and dietary counseling. So, what treatments will you receive? There are treatments that will be given in the office, and there'll be things that will be done at home for homework. Obviously, acupuncture, Moxibustion, Tui Na, reflexology, cupping, Gua Sha will be applied in office. Usually, and this depends on a lot of factors, which we will discuss, usually it'll be 2 per session. So if you're coming in for back pain, we might do acupuncture with cupping. Or we might do acupuncture with Moxibustion, depending on how the back pain is presenting. If you're coming in with urinary problems, we might do acupuncture and reflexology. If you're coming in with insomnia, we might just do bodywork, full body, Tui Na, bodywork, and reflexology. Some patients will only get acupuncture. Some patients may not need acupuncture, and we might just do Moxibustion and Tui Na. It all depends case to case. And then at home, and for homework, most important, dietary and lifestyle changes. You'll also be taking your internal herbs at home. Internal herbs is like getting treatment twice a day. There's 2 doses a day for the most part. Take after breakfast, after lunch. This will strongly increase the benefit of everything we're doing in office. External herbal medicine for certain patients will be applied in between treatments. to increase the efficacy. Qigong, if it's something you're interested in, something you're willing to put the time in, I'll be willing to work with you on showing you the Qigong I know, or possibly referring you to a practitioner or online course that might be helpful for you. For certain patients that need intensive Moxibustion treatment, I oftentimes send patients home with Moxa to do at home. In Asia, this is often done as a home treatment as well. Moxibustion has a cumulative effect, so it's something that sometimes has to be done daily or multiple times a week. So some techniques we would do in an office, some techniques you would do at home. Everything is highly personalized. Each patient, depending on their condition, will mix and match the treatments to meet their particular needs. Acupuncture is a medical system that can be used to treat a wide array of medical conditions. A lot of patients come to the clinic expecting acupuncture to only be useful for pain, but it's actually useful for many other conditions, and there are some practitioners that only use acupuncture to treat a wide array of conditions, including skin conditions, digestive conditions, menstrual disorders in women, menopausal issues, respiratory issues, breathing problems, cardiovascular issues, circulatory issues, many different types of conditions aside from pain conditions. TCM, or traditional Chinese medicine. So as I said earlier, Chinese medicine has an over 2,000-year-old history. In the past 60, 70 years in China, they developed what's called TCM, or traditional Chinese medicine. It's a standardized system just to make a standardized way of teaching a large amount of practitioners. The standardized system of acupuncture, standardized theory within herbs. And if you go to a hospital or a university in China or in the United States, you will see similar types of training and similar applications of the medicine. The medicine as it's practiced in China, because of the history there, the training is a bit more rigorous within the schools. But the US and Western nations are slowly catching up. So how does acupuncture work? There are many different theories of how acupuncture works. So there are meridians that pass through the body. They go through all the muscles, all the joints, around all the tissue in the body, pass through different organ systems. And when you place a needle into the points along those meridian lines, you get an increase in circulation of blood and fluid and an overall relaxation in the body. So you're improving and increasing organ function and reducing inflammation and decreasing pain. As I said, there are many other explanations. There are plenty on YouTube. I suggest researching a bit and see which one fits your particular view. So acupuncture works through the outside in. So it's not like taking a pill or taking herbal medicine where you ingest it and then it goes through your digestive system and then you notice a change. It's a physical system. It's similar to Bodywork, where you're putting needles into the body and you're stimulating movement, as I said, of blood, fluids, and you're increasing circulation. You're getting the tissue to relax, getting the body to relax, and as a result, we're improving organ function, decreasing pain, and reducing inflammation. So we put the needles on what we call the distal areas of the body, so far away from the problem area, and then those areas will track back into the body and have an effect on the body. So how do I use acupuncture? So let's say, for example, a patient comes in with really bad back pain and they could barely touch their back. It's so painful. We'll put needles in other places on the body to get that muscle tissue to relax in the back. And then we could apply other modalities like cupping and Gua Sha and massage to go deeper into that area of the back to get it to alleviate the cause or the root of that particular pain condition. Acupuncture, for me, the way I use it, it's only part of the picture, only part of the treatment. We'll use acupuncture to alleviate pain, increase digestive function, help with stress and anxiety. And then we'll use other modalities to address more systemic or systematic type problems in the body. We'll talk about that as we go forward. So when is acupuncture contraindicated? So acupuncture is suitable for most patients. There are a few cases where I would be hesitant to use it. First off, if a patient is extremely weak, extremely tired, also if a patient has any kind of muscle cramping, more to severe muscle cramping. If there's mild muscle cramping, it should be okay. Acupuncture can actually aggravate those symptoms of cramping. So we would do usually herbal medicine for that at the beginning until the body becomes more stable and the cramps are diminished. Acupuncture is not contraindicated for pregnant women. So acupuncture can be performed on pregnant women. There's just certain precautions that need to be taken. Acupuncture is safe on all ages, all children. The only other case I wouldn't use it would be obviously for hemophilia, but I haven't had many calls from any hemophiliac patients, so it's generally not an issue that I've had to deal with, and I would assume most would not seek treatment for acupuncture. So there are many, many different styles of acupuncture. As I said, through those 2,000 years of history, there were hundreds and hundreds of family styles of acupuncture that use the same points, they use the same herbs, but they use them in greatly different ways, and they all found highly effective ways to benefit their patients. The style of acupuncture I practice, in general, it's called distal acupuncture, where we needle mostly on the limbs, sometimes on the torso, but mostly on the limbs. I also practice scalp acupuncture, which is we insert needles very superficially into the skin of the scalp. It's almost, or it is painless, or nearly almost painless. And that's particularly good for anxiety, depression, and motor dysfunction, so neurological conditions where patients have issues with body movement. I also practice TCM, or traditional Chinese medicine, which I learned in my training at school. Next point would be fewer needles is often better. So a lot of people think the more needles the better. That's not necessarily the case, and in my experience, that's not the case. The fewer needles, the better. We're trying to give a very, very clear message to your body. I usually use 6 to 8 needles max during the sessions. There have been times where patients come in for back pain. I use 1 or 2 needles, and during that particular session, their pain was completely gone. So more is not necessarily better. Often putting too many needles will kind of confuse the body, because you're sending many different signals. The fewer signals, the more direct and focused signal we send to the body, the more direct and strong and efficacious the effect will be. So there are many sensations you could feel during your acupuncture session. When I put the needle in, all you may feel is a little bit of heaviness where the needle is. You might feel a sensation of like water rushing up or down the limb. You might feel a little bit of achiness. It shouldn't feel uncomfortable. If anything is uncomfortable, you tell me which needle is bothering you. We remove it. We try to make it as comfortable as possible. The main goal for treatment is to make you as relaxed as possible while treating. The more relaxed you are, the more efficacious and beneficial the treatment is. So I don't want to get the right point and you're feeling uncomfortable. The first few treatments, I'm kind of gauging your comfort level, And the needles will be adjusted, the number of needles, the amount of stimulation to the needles, based on your comfort. I'm following you. Even if it's the best treatment on earth and you're not comfortable with it, we'll adjust to make you feel comfortable. And here's a picture of me performing acupuncture on a patient. And one needle on the inner part of the lower leg, shows me palpating, and then one needle on the outer part of the opposite leg. And then showing some stimulation of the needle, some palpation, gentle, painless insertion, comfortable treatment. Moxibustion. So the Chinese name for acupuncture is Zhen Jiu. Zhen, the character you see here, this first character, means needle. Jiu means moxibustion. So throughout history, acupuncture and moxibustion was actually the name for acupuncture. So you can't have acupuncture without moxibustion. So what is moxibustion? Moxibustion is actually heat therapy that some think actually predate acupuncture. So there's a plant called mugwort. There's many different species all over the world. The particular one in China, they've figured out that some say 6,000 years ago this was figured out. They processed the plant into like a floss. It looks like cotton, and I'll show you in the later slide. And the moxibustion is either rolled into like a cigar, or it's piled on top of points with a medium underneath, usually ginger. And we use it a lot for weakness conditions, or when patients experience symptoms that are usually worse with cold, or their body generally feels cold. Moxibustion, as I said, predates acupuncture. Moxibustion works similar to acupuncture in the sense that we use the same points that we use in acupuncture. So just as I said, you might feel that water feeling rushing down the arm when the needle goes in. Comfortable sensation. When we apply moxibustion to the same points, you should feel a gentle feeling of warmth traveling down the limb, or if you do it on the belly, you should feel it traveling throughout the abdomen. It should be a very gentle, warming sensation. Acupuncture works by relaxing the tissue, increasing circulation, whereas moxibustion, you're adding heat, you're adding warmth to the body, you're strengthening the body. Acupuncture and moxibustion are often used together, but moxibustion, when people talk about the body's self-healing mechanism with acupuncture, it's actually moxibustion that does that. It kind of recharges your body's battery, makes your body stronger, recharges your body, and it helps with increasing immunity, warming your body, strongly improving digestive function. Another thing it really works for is actually stopping bleeding. I use moxibustion a lot for patients that have loose stool. They have difficulty moving their body. So even some people use it. It needs to be very strong treatment, continuous treatment. You could even use it for limb dysfunction and difficulty walking. I use it, for example, for stopping bleeding, so excessive menstrual period, excessive bleeding after giving birth. It's also used for excessive sweating, so certain types of night sweats it's good for. So it's very good at strengthening the body and increasing organ function in the body and strongly improving digestion. And home treatment. Moxibustion is a therapy. There are some methods of application that could be done at home, and we would go over that with you if needed for your particular case. So the Moxibustion plant, this is the mugwort plant, and it's processed into Moxibustion, or the moxifloss, and this is formed into moxicones, Moxa poles, used loose like this, used in various different ways. Okay, so moxa treatment, some examples. So this is dragon moxa or snake moxa. Use the ginger with loose moxa piled on top, and it's lit as a tremendous amount of heat, very comfortable heat. Uses for severe fatigue, severe joint pain, spinal disorders, general weakness. It's also used for general health. And this picture is a picture of shell moxa, abalone shell moxa on the back. And on the feet, we have moxa shoes. So this patient was having fatigue and some foot pain. So the fatigue is the shell moxa on the lower back, and the shoes, there's moxa inside of those cloth shoes. Again, comfortable, relaxing heat. This patient is getting ginger moxa. So those are cones, 6 cones of moxa burning on top of 6 slices of ginger. This type of treatment I use a lot when patients have lower back pain that's worse at the end of the day. It tends to feel weakness in the lower back, coldness in the lower back, some urinary and digestive disorders, reproductive disorders will use this kind of treatment on the lower back. Again, this is the shell moxa, so there's a cloth hat, there's some salt, which you can't see in this picture, abalone shell, and then there's moxa inside of there burning. It's a gentle heat. And next to it is the smoke extractor to make sure that the patient isn't choking from all the smoke. So all the smoke is extracted from the room. I have fans going. And this one is for, I think this particular patient was having lower abdominal pain during her menses. So we place the moxa for lower abdominal pain on menses. We do actually the lower back. This is direct moxa. So it's very, very high grade moxa. And it's burned directly over the skin. It's put out before you feel any burning sensation. It should just be a gentle warmth. Direct moxa is used for just severe weakness, low immunity, severe fatigue. It's also good for stopping bleeding. On patients very, very weak, we'll do this type of moxa. This is pole moxa. So that loose moxa is rolled up into a cigar-shaped apparatus like this. And this is often used for pain conditions. So this patient was having knee pain. So we heat up specific points, and they should feel a gentle heat going up and down the meridian and opening up the stagnation of the stuck blood and fluid that's within the knee joint. Again, very comfortable, relaxing treatment. This is ginger partition moxa as well on various points on the abdomen. This patient was being treated for infertility. Moxa on the abdomen is often done for infertility. It's very effective in combination with acupuncture and internal herbal medicine. So Tui Na and reflexology. Tui Na translates as pushing and pulling. It's just a type of Chinese medical body work. Tui Na is similar but also different from acupuncture. So whereas acupuncture, we're needling into one specific point, on Tui Na, we're massaging the meridians. So it's not so much point function, on the way I learned it at least. We're not focusing so much on points, we're focusing more on the channel pathways, we're focusing more on the tissue, the muscle tissue, the bone tissue, the tendon tissue, the joints. It's very different from deep tissue massage because Tui Na and reflexology could actually be used to treat internal medical conditions. So by massaging these meridians, by massaging these different areas of the body with different types of hand techniques, we can have a similar and sometimes stronger effect in acupuncture on digestive issues, on menstrual issues, on breathing issues, urinary problems, Massage is actually one of the more misunderstood methods within Chinese medicine. So how and when do I use Tui Na? Tui Na is probably, out of all the modalities, the most applicable to the most amount of patients. It's very effective. The only, again, similar to acupuncture, if someone is extremely weak, it'll feel good, the massage, but it will be difficult and take a much longer time to get the person to recover from their particular condition. Usually if someone's very weak, we'll use Moxibustion, or we'll do internal herbal medicine. So regardless of the condition, massage is a good treatment added to Moxibustion, added to acupuncture. It enhances the effects of herbal medicine. It's just all around a great treatment for modern, stressed out people. So I learned Tui Na maybe 15 years ago, 20 years ago. I learned during my schooling for Chinese medicine. And then in 2011, I went to China and I studied with a teacher for a few months. And then I've been back and forth to China to study with him in the hospital. In the hospital and in his home, so seeing with his private patients. And he really opened up my eyes to how strong bodywork and massage could be in treating a wide array of conditions. Reflexology. What is reflexology? Reflexology is foot massage. So there's certain reflex points on the body that could treat the whole body. So the foot is a microsystem. We use the word microsystem. So there are points that'll address all the different organ systems, address the different parts of the body, and we stimulate them. I usually use a massage tool to stimulate the bottom of the foot. Some patients need this, some patients don't. I often would use reflexology for urinary problems, reproductive issues, stress and anxiety type conditions. There are more applications to it, but those are the ones I use it for. So Chinese Tui Na and Bodywork in general is a whole body treatment. Whether you're coming for foot pain, back pain, you're going to get a full body treatment, touching the abdomen, the back, the legs, the arms, the head, the neck. And by doing this, we address the whole body, all body systems, all the meridians, and to make the body more relaxed and to just get a much stronger treatment than just focusing on the area, only the area of discomfort. Here's some pictures about reflexology. There's a chart of all the reflex areas. There's a map of the entire body. You can treat the whole body through the foot. And this is a picture of me with my teacher in Beijing. This is probably about 7-8 years ago by now. Studying massage, and we were doing reflexology at this picture. Internal herbal medicine. How internal herbal medicine is prescribed. So prior to your first visit, I'm going to have you fill out a comprehensive health history, which will go through your main complaint and all of the contributing symptoms related to your health. That includes digestion, sleep, urination, menstrual cycle for women, any palpitations, head to toe analysis of all your body systems. Once I have all those symptoms, I'm going to go through everything, and we put together a formula that will match all of your symptoms. So the main complaint will be addressed, as well as all the contributing symptoms that you may be experiencing. So let's say you come in for eczema, for example, but you also have constipation, insomnia. So a formula would be put together to address those 3 issues and any other issues that would come up as we're discussing. So herbs work through the stomach. So digestion is first priority. If you come in with back pain and you also have severe constipation, let's say you're only passing stool once every 10 days, it'll be with herbal medicine, not with acupuncture. With herbal medicine, it'll be very difficult to treat the back unless we address that constipation first. So by making the stomach function as best possible, so that means eliminating bloating, eliminating constipation or loose stool, have normal stool, any nausea, any reflux, any hemorrhoids, anything along the entire digestive tract would need to be addressed. Oftentimes, just by addressing the digestion as a contributing factor, you'll see a diminishing of a lot of your other symptoms. So I've seen patients where they come in for anxiety and acne, but they also have constipation. Once we address the constipation, the anxiety and the skin condition, acne will just oftentimes will diminish greatly on its own or just disappear. So stomach is the main priority at the beginning of treatment. So again, prioritizing symptoms. So first, we focus on treating the stomach, and then we focus on treating everything else. I'm not saying that we wait to treat everything else, but within the formula itself, 50% of it at the beginning will be stomach, 50% will be your main complaint and all the other symptoms. As your digestion starts to stabilize, we get more intense with addressing your main complaint and other symptoms. So custom herbal formulas versus patents and pills. At my office, I only do custom herbal formulas. So custom herbal formulas is exactly what it sounds like. Each individual patient will have a formula that is specific for their symptom presentation, the way their body is functioning at that time. I don't use patents or pills, which are pre-made medicines that are not customized for individual patients. They treat a wide array of conditions, but it's not customized to that individual patient. So I'll give you an example. Let's say we have 10 patients with insomnia. That's one thing they have in common, but they have all their other symptoms are different. Let's say this patient has insomnia with constipation. This patient has insomnia with headaches. This patient has insomnia where they have trouble falling asleep. This patient has a difficulty staying asleep. There's all different treatments. Or even if a patient has trouble falling asleep and staying asleep, it's another treatment. All the herbs are customly put together to address the way the symptoms are presenting for your particular case. How and when do I use internal herbal medicine? I often like to use herbal medicine with a lot of patients. If patients come in with complex conditions, whole body pain, let's say fibromyalgia with digestive issues, if there's a lot of body pain, there's a lot of digestive issues, herbs will often be incorporated into treatment. If a patient comes in, let's say with headaches, but their digestion's okay, and their sleep is for the most part okay, and they're a little bit stressed, so we would treat the stress and we treat the knee pain. Usually we do about 4 to 6 sessions with acupuncture, massage alone, bodywork alone. If we're not seeing the changes we want, then we would do herbs. But for more complex conditions, I like to start sooner than later. I don't use herbs with every patient, but I use it with a lot of patients that have more complex conditions. Are Chinese herbs safe? So Chinese herbs have a long history, as I've already shared. 2,000 years, trial and error. They've figured out how herbs can be combined, what herbs can be combined with other herbs to mitigate or to lessen any possible side effects that you could think of. Whereas with Western herbal medicine, I'm not speaking to degrade or to downplay its effectiveness, but it's very different than Chinese herbs. Whereas you might give an herb singly, but it has very specific function, and it may not be suitable. Let's say a patient has acid reflux, and they take an herb that would treat acid reflux, but it'll only treat acid reflux. It could cause other issues that you may not be aware of. So with Chinese herbs, the way we treat multiple symptoms at once is in a formula. So the formulation could be anywhere from 5 to 15, even 20 herbs. And these herbs work together to create the strongest therapeutic effect with the least to no um, negative effects. A negative effect might be occasionally, maybe let's say you're taking your formula and you get a little bit of loose stool. Herbs will be adjusted to make sure that the stool will be normal. So there's constantly tweaking and adjusting of the formula to make sure it's meeting your particular needs without any side effects. Also, all the herbs that I use have been tested for heavy metals, have been tested for pesticides, have been tested for any toxicity. If you're interested in knowing more about that, feel free to ask me. So in my office, I usually prescribe granules. Granules are the easiest to take. They're mixed together to make formula. If you look in the lower corner here, this is a snippet of the granule pharmacy that I have in the office. I use anywhere from 80 to 100 different herbs, depending on the case. They're mixed, as you can see. This is me mixing a formula for a patient. Each herb is measured out individually, and it's put into a small bag. And just all you have to do is add boiled water, and then you have a tea, and then you take your medicine. External herbal medicine. We have internal versus external conditions. Internal conditions has to do with organ function, whether it's digestion, respiration, breathing, issues around the menstrual cycle in women, some types of pain conditions. But external conditions are usually categorized as pain conditions. So your elbow pain, your knee pain, whether it's an acute injury with swelling and inflammation and heat and difficulty moving, or it's chronic pain that's sensitive to cold, or a lot of stiffness, a lot of sharp pain. All these things are differentiated when we're using external herbs. So I use external herbs mostly for chronic pain. Sometimes when patients come in with acute pain, I'll use that, but a lot of times I use it for chronic pain conditions. So I use poultices, which is different types of herbal blends mixed with a medium. That could be Vaseline, that could be vinegar, it could be different types of oils, it could be even green tea. It's mixed to make a paste, and it's applied to the joint or the muscle wherever the pain condition is. I also use patches, which is a little bit easier to administer than poultices. It's these sticky patches that stick on your back, stick on your knee, stick on your neck, stuff like that. Liniments, which are alcohols that have been infused with herbal medicine. And this is easy application 2 or 3 times a day in between sessions for your joint pains, for your stiffness, for bruising, lots of different things. Also use soaks where herbs are boiled into a tea, and then a limb could be soaked in there. It's very good to speed recovery from stiffness in a joint, cold joints that are difficult to move, very painful joints. Soaks are used more for conditions that have a lot of stiffness. It could be swelling. It could also be very sensitive to cold and damp weather. Usually use a lot of soaks. Home treatment. External herbs are often prescribed to be taken home. They'll be applied in the office, but I often prescribe them for patients to apply in between our sessions to enhance the effectiveness of the treatment and to speed recovery while working at home. So here are some pictures of the patches that I use. Some of these are used and they have varying strengths, and they vary by condition. So there's some patches we would use for acute injuries where there's a lot of swelling and a lot of heat and a lot of bruising. There are some patches we would use for pain that's worse with cold and there's a lot of immobility. Some we're going to use I just have you put it on before bed for stiffness upon waking, and when your pain's worse in the morning, you can wear it through the night. This varies patient to patient, and we differentiate based on the presenting symptoms the patient's experiencing. So here's a picture of one of the patches being applied. Someone had stiffness in the lower back. It was applied after treatment. And here's a picture of some of the liniments and some of the paste that I use. Again, it's differentiated based on what stage of the injury are. So there's acute, there's subacute, there's chronic conditions, depending on where the swelling is at, if there's bruising, if it's sensitive to cold, if there's stiffness. This is highly personalized as well. There are many different topical applications, and depending on how your symptoms are presented, you'll be prescribed these as well to be put on in between sessions to speed the effectiveness of treatment. Qigong. Qigong is its own complete system of health and healing. So some would say that Qigong actually predates acupuncture as well. It's a complete system of health and healing. It could also be used to help with many chronic and acute illnesses. There's a use of breath, relaxation, movement, and posture. So holding certain postures, certain breathing methods create tremendous amount of relaxation, and they'll open the same meridians and create circulation through the body, similar to acupuncture, but you're actually doing it to yourself. Qigong is the ultimate self-medical treatment. The more you practice, the more effective it is. You're in control of your own health, which I'm a big fan of. So the more you could practice Qigong, the better. Qigong is more powerful than acupuncture and herbs. I know I shouldn't be saying that as a practitioner, but it is true. Even for my particular health concern, I have found this to be the case. When I first found acupuncture around 2001, I was experiencing a lot of anxiety. I went to a local acupuncturist where I was living, and I just did acupuncture, a little bit of Moxibustion, and it was helpful. It definitely took the edge off of my feeling of anxiety, but it didn't really get to the root of it and really help me as much as I was hoping. But it sparked an interest, and I eventually went to acupuncture school. And in the process, I found a Qigong teacher. I learned different postures, different exercises. And I found that it was tremendously helpful for my anxiety, more than anything I had ever done before. It's more than I had taken medication, Western medication for it. I had done acupuncture, I tried diet. But the Qigong really, really not just took the edge off, but I really started to feel those feelings of anxiety to really dissipate. That's not the case with everybody, but for me, that was the case. The only issue is it took me about 3 to 4 months to really start feeling that, and you have to practice. At that time, I was practicing maybe 30, 40 minutes a day. There have been times in my life where I was doing 3 hours a day with family and everything. That's not necessarily the case right now, but I was practicing pretty heavily in my 20s and my early 30s. And that's the only issue with Qigong. In this hectic world, it is the most beneficial practice that you could be doing because it creates tremendous amount of relaxation. It helps restore the function of the nervous system. It helps restore organ function very strong without having to take anything, without even having to get any type of treatment. But the biggest thing you need is time. You need free time, at least a half hour a day. And that's for anxiety and stress or maybe insomnia. But for more complex health conditions, you may need to practice at least an hour a day, regularly, daily basis, to really reap the benefits of Qigong. For patients that are interested in that, I'd be more than happy to share some practices with you and point you in the direction of learning Qigong more deeply. It's something I'm passionate about and I love to share with patients. But again, you need time and practice and patience to really reap the benefits. All great Chinese medicine practitioners use Qigong to maintain their own health and improve treatment ability. So doing a lot of body work and massage can be tiring, um, especially with a hectic lifestyle. I have children myself, so doing Qigong helps maintain my own health and helps maintain my ability to treat patients. It also, there's specific types of Qigong that I use that develop hand sensitivity and hand strength and basically how to move my body to use the least amount of energy, but also to cultivate more and to not get tired from living in the modern world and working and seeing patients. So again, all great practitioners of Chinese medicine had some sort of cultivation practice involving Qigong or meditation or something like that. Cupping and Gua Sha. So everyone has seen pictures, I'm assuming, of those circular marks that look like bruises on people. I know years back there were pictures of Michael Phelps getting cupping done. It's become somewhat popular in popular culture. And some patients will come specifically asking for that. But not all conditions and all patients need cupping. When it's needed, it's greatly beneficial. How and when is cupping used? I use cupping a lot for muscle tightness in the upper back, muscle stiffness in the lower back, a lot of chronic pain conditions on that's related to the back. That could be hip, around the waist, lower back, mid back, upper back, shoulder. Sometimes it's applied to the abdomen for specific types of conditions, but usually only one cup is applied. It's not like a whole, not like 20 cups. I use it often when symptoms are worse with cold. Oftentimes, if someone comes in with back pain that's worse with cold, and you apply cups, once you take those cups off, their back, where the marks are, is actually going to feel cold to the touch, colder than the rest of the back. So that's the body actually releasing that cold trapped in that muscle tissue that's causing that stiffness and that pain. What is Gua Sha? Gua Sha is another external treatment similar to cupping, but instead of using the vacuum cups, we use I often will use a porcelain spoon with a blunted edge and some lubricant, oftentimes just sesame oil or olive oil. It's spread over the area, and then gentle rubbing over the skin will create a similar look to cupping, but it is slightly different. The benefit of Gua Sha is you can get into more smaller joints and the more difficult areas to reach with cupping. So that could be the neck, the elbow, around the knees, even the wrist. Some people do Gua Sha on the backs of the legs. Difference in cupping is you use it for more where there's heat involved. So a lot of times after you do Gua Sha, the skin will feel very warm. The patient will feel warm as well. So Gua Sha is often used. It can be used for heat stroke. Actually, it's very effective for that. I've used it in the past. Patients come in with swollen gums. It helps alleviate all that inflammation in the mouth. I've used it in the past before COVID for patients that come in with acute sore throat, sinus infections, stuff that's everything like yellowish. There's a lot of burning sensation. Gua Sha is really good for that, or headaches, or when people generally just feel warm. Also, I use it for stiffness, just like cupping. Some patients prefer cupping more than Gua Sha. It depends, and also depends on the other presenting symptoms when we use it. So both drastically speed up recoveries from chronic pain conditions and other conditions as well. So patient comes in with a stiff lower back. Acupuncture will help to alleviate that stiffness and any pain, but the Gua Sha and cupping will greatly open up that muscle tissue and increase circulation to that area and speed up recovery by weeks, even months. So it's something they do employ with certain pain conditions. So depending on the color of the markings and your health conditions, it will take anywhere from 2 to 7 days for your skin to return to normal. This is normal. As you get better, actually, the more you do it, the less markings they are, which I can explain why that happens in another video. And also, it looks worse than it feels. So patients could have anywhere from pink to red, dark red, even purple. The more severe the coloring, the more you actually needed that treatment, and the better you should feel afterwards. It shouldn't feel, might feel a little bit sore the day or two after. As the cupping marks and gua sha marks go away, it's like it was never done, and you should feel a lot better from those symptoms you were experiencing. So here's a picture, few pictures of me doing cupping. Some are glass cups, some are plastic cups. These patients were coming for shoulder pain, upper back pain, and as you can see, the different coloration on the cups. All of the suction was the same, but only certain areas showed coloring, and that kind of drove me to more target those specific areas with further treatment. So cupping is diagnostic as well as treatment. So the more we see coloring in certain areas, we know that that's where the area that the problem is stemming from. So here is some gua sha pictures. This is the oil, and this is the spoon that we'll use. So we rub the spoon over the different parts, usually the neck, upper back. Do it on the arms as well, down to about the elbow, even the forearm when necessary. Also, we could work in the hips, in the legs as well. Oftentimes, I'll do it on the chest for chronic cough. This patient here had a chronic cough and chronic sore throat, which wasn't sure the cause. It wasn't an acute illness, so I was willing to do the gua sha with him. Also, this patient had a lot of gum swelling. So gua sha I've found is really good for clearing up swelling in the gums, good for clearing up coughs, good for clearing up sore throat. And this patient felt much better after we were done. Lifestyle adjustment and dietary therapy. The most important part of your treatment is right here. So you are in charge of your health. Everything you eat and do during your day has a profound effect on your health. Altering your diet and making slight dietary and lifestyle adjustments is the most lasting and most powerful part of Chinese medicine. Everything we're doing with our herbs, with our acupuncture, with the Bodywork, with the external herbs, it can provide tremendous relief from your condition. But unless we make certain adjustments to our lifestyle and diet, we can never really eliminate the root cause of those particular problems. And oftentimes, if we don't correct those issues that are causing the problems, you may get, for example, come in with lower back pain, and we do acupuncture, we do massage, we do cupping, and your back's feeling good, but we didn't change our habits that created the back pain in the beginning. You might be ringing again 6-8 months later. I was feeling so good, and now my back pain's back. So this is not what I want from my patients. While you're with me, I want to get you out of discomfort, help you get out of discomfort quickly, but educate you on how to stay out of that discomfort, how to make your body as healthy as possible, and to maintain health. 60% of your progress will be based on how you adjust your lifestyle and diet. If you come in with eczema, for example, eczema is highly sensitive to diet. And there's a certain foods that'll trigger that itching and that burning and even the drying, all the skin conditions. If we eliminate those foods for a certain amount of time and we recover from that eczema, we could slowly start to reintroduce those foods on a limited basis. So our goal is to teach you what those foods are and how to mitigate any effects from your skin, for example. But this could be for any condition and all conditions. There are very specific changes we'll make, and there's also very general things that changes we'll make. The patients that make the changes have the most profound improvements in health. Oftentimes, dietary and lifestyle adjustments alone are all that you really need. It may take a little longer, but just changing your diet, eliminating certain foods, eating more of certain other foods, changing your sleeping habits, your exercise habits, could drastically improve your health, and you'll end up needing less treatment in the long run, and your body will just feel better overall. So I have an upcoming online lifestyle program and dietary therapy program that I'll be sharing soon, that'll take patients through the general suggestions that I do give to most patients. There are certain things that people are doing that are causing problems, and this is causing problems for most people. There will be specific suggestions I give to patients. Remember, your health is in your hands. The more you take care of your own health, the less treatment you'll need, and the healthier you're going to be into old age.